All right. Hey, well, I expect a few more folks are going to trickle in for the next 5 minutes or so. So we've got a pretty small group. Let's do like a round of introductions. Just sort of name, pronouns, organization, and title. Start off, Jesse Simpson, he, him. I work as the government relations and policy manager for the Housing Development Consortium. I'll throw it to Sonari.
Hi, Sunari Marshall, the Deputy Division Director of the Housing, Homelessness, and Community Development Division at King County, and an HDC board member. Pass it to Kelly.
Hi, Kelly Ryder, she, her pronouns. I'm the Director of External Affairs for the Department of Community and Human Services at King County, and a former HDC alum. And I will pass it over to Leon.
Good morning, Leon Richardson. I'm the Division Director for Adult Services within the Department of Community and Human Services. And my division has the privilege of stewarding the Veteran Seniors and Human Services Levy. And I don't know who to pass it to.
Let's have Tim.
All right, my name is Tim. I use he and pronouns, and I'm the member connector and program coordinator for Seattle King County Coalition on Homelessness. And I would like to pass it to Lauren at DESC.
Hi, everyone. My name is Lauren Fay. I use she, her pronouns. I'm here from DESC, where I am the senior business manager. And let me take. I'll pass it to Chad.
Hi, everybody. Chad Vaculin, use he and pronouns. I'm the Advocacy Mobilization Manager at HDC. And I was a little late, so apologize if I'm picking the wrong person that's already gone, but I'll go with John.
Good afternoon. I'm John Friedel, he, him. I am the Wellness Program Manager for CIRC, formerly SHAG Community Life Foundation. We're a current grantee of King County with the levy. So let's see if I can figure out Roberta. It looks like maybe hasn't gone.
Hi, Roberta Scher with Beacon Development Group. I'm senior developer in she, her pronouns, and I think there's just a phone number. I don't know if it's a separate person or that's someone who's not using their audio.
Who is that? The 206-683 number? It's like *7 or something to unmute. Correction, it's *6 to unmute.
Can you hear me now?
Yep.
Oh, hi. This is Robin Amado, and I work for myself as a consultant, and I'm on the phone today, so I'll be muting myself again and just listening in. Thanks.
Great. Then I think last up is Nick. Do you want to just introduce yourself?
Hi, my name is Nick from Bellwether Housing. I use he, him pronouns. Also mostly be listening.
Great. All right, Sonara, you want to kick us off with a little introduction about your role and engagement with the Veteran Seniors Human Services Levy in the past and present?
Sure, and I'll be splitting that with Kelly. So as I mentioned, Sunari Marshall from King County. I'm an HDC board member. It's always exciting to be able to be here with members and share the work of my awesome colleagues at the county. So today we're going to talk about, we have Leon here, who's the division director from our Adult Services Division, who's going to talk about the Veterans, Seniors, and Human Services Levy, which folks may know has been one of the many sources we've been able to deploy to support affordable housing in the county over the past few years. And that's really been due to the strength of collaboration with folks like HDC. So Leon's going to go into a lot more detail about where we are with the levy today. Some of you may have heard some of this at a couple of previous events, but we're really looking forward to your questions, curiosity, and any feedback you might have on the process so far. But also, we're lucky to have Kelly Ryder here, who's former HDC staff, who can talk about HDC's previous engagement with the levy.
Thanks, Sunari. So I'll give us just a few minutes of intro before turning it over to Leon, and then I've got to drop off at 11:30, but always happy to follow up on chats. I think Robin Amadon is maybe the only one of the crew that was there in 2011 when I stepped into staffing HDC for the sole purpose of staffing the campaign for the Veterans, Seniors, and Human Services Levy. So this is the third time around, and I will date myself in that. So I'm excited for HDC to continue to engage with the Veterans and Seniors and Human Services Levy, which has changed a little bit in name since 2011 when it was just the Veterans and Human Services Levy. Leon will talk more about the importance of the housing components, but just definitely want to frame that we very much continue to rely on our partnership with HDC members and our permanent supportive housing providers in particular to continue advancing our housing goals within the levy, and welcome continued partnership on ensuring that these resources can be best put to use. So as we firm up the timeline between now and the end of the year for this proposal to go to council in January, very much want to welcome your insights today and in future conversations so that we can make sure that this levy is crafted the way that it needs to be. I want to remind folks that the Veterans Levy in particular is very different than the form of the Seattle Housing Levy. So King County relies on a tool that Leon can talk more about called our implementation plan, so that this first step we'll be proposing in January really just shapes the ballot measure, and then an implementation plan will be proposed to council later in 2023 that will really detail our funding path. So a lot of conversation and details still to be confirmed later in 2023. This is actually very early conversation, and so excited to hear more of your feedback and questions, and we'll keep up the partnership. Jesse, I think, also asked me to cover just a few minutes of what else is going on at the county, which includes our crisis care centers proposal. And so I know some folks were surprised to see the executive propose a separate levy that is proposed to go on the April ballot next year, in partnership, in part with many of our permanent supportive housing providers, but also certainly many other members of the community. We have identified that similar to our crisis in affordable housing and homelessness, we also have a very big gap in services for folks seeking behavioral health supports. And we know that that experience is happening very much in our housed community as well as in our homelessness community. And so the executive has proposed a levy to go on the April ballot to be able to address that primarily through something we're calling the crisis care centers. So I'm going to pull up a few slides just to go through really quickly, and then again, welcome continued conversation on this. For folks who are not as familiar with our behavioral health work, the county does have 5 divisions, one of which is the Behavioral Health and Recovery Division within the Department of Community and Human Services. And so just want to ground folks first that behavioral health is the way that we talk about both mental health and substance use disorder. So when we talk about behavioral health, it very much is a comprehensive way of thinking about folks' behavioral health needs. The levy is crafted to address 3 primary challenges. One is that if you broke a bone at any time, most of us on this call would have some sort of urgent care option that really is targeted at serving folks to repair and treat broken bones, to treat folks with high fevers and physical illnesses. What we do not have is walk-in treatment for folks suffering from behavioral health crises and needing immediate treatment for folks that can't access their outpatient treatment on the weekends after hours. So the crisis care centers are really meant to respond to that need. The second piece that the levy responds to is the fact that we do have something called residential treatment facilities in our continuum. And this type of facility is something that really is intended to be a higher level of services than what we offer in permanent supportive housing. And when residential treatment facilities aren't using their part of the continuum, we know that that increases the needs and the acuity levels of the folks that we are serving in permanent supportive housing. And so this levy will also bolster our residential treatment facility capacity by bringing back capacity that we had in 2018. Since 2018 until now, we've lost about 1/3 of our beds in this type of facility. And given the growth of our population, the growth of acuity of behavioral health needs throughout the pandemic, we know that we need to return at least to our 2018 levels. And the third piece, very similar again to what we're seeing in the housing space, is a need to invest in workforce. And so not only are we investing in workforce by paying sustainable wages and operating costs for our crisis care centers, but we're also investing in apprenticeship programs, career pathways, and other workforce investments to ensure that we can recruit and retain a quality workforce for our behavioral health providers across the board. So those are the three purposes. I'll scan through just a little bit of high level so that you all, when you're having conversations with community, kind of understand the framing that we're providing and the way folks are talking about behavioral health, given how many intersections there are between your work and the work of our behavioral health continuum. One of the primary frames that we're using for the build out of our behavioral health system is something that the federal government as well as the state government uses. And it's this three-part idea that folks need someone to talk to, someone to respond to their needs, and someplace to go. And so the state has done a lot of work here over the last few years to build up what's called the 988 hotline. Folks may have seen that. It is primarily a suicide prevention line, but also responds to other behavioral health system needs. The state has also invested a significant amount of money in mobile crisis teams. We've complemented that at the local level by King County investing in specific permanent supportive housing mobile crisis teams. What we still don't have is someplace for people to go. And so in order to respond to that and to the many folks who really need a place to be able to refer folks, to be able to go when they themselves have a crisis, we are proposing this creation of crisis care centers. And I'm going to skip through pretty fast because I know Leon is really the main show. So bear with me. The crisis care centers are proposed to be 5 in number, 4 distributed across these 4 geographic areas of the county, and 1 that would specialize in serving children. And the last thing that I will offer about the crisis care centers, as folks are trying to understand what exactly is a crisis care center. A crisis care center is intended to address 4 main levels of services. One is that walk-in capacity that we talked about, that folks can see a walk-in clinic, they can get an appointment just like an urgent care. For other folks, they might need a higher level of service. And so this may be individuals that are in permanent supportive housing today that are in deep crisis that need a few days to go somewhere else and to be treated by specialists who really understand behavioral health treatment at a different level than our permanent supportive housing providers. For those folks, we have 2 different service levels. One is a 23-hour observation unit. So this is a model that we're seeing working in Arizona where folks can stay for up to 23 hours. Folks can observe them and understand their true treatment needs. Can they actually return back to their home? Do they need something like a 14-day stay? Do they need involuntary treatment? That the 23-hour observation allows folks to really apply their specialty to understand their needs and best treat them where they're at. The 14-day crisis stabilization is something that we actually have right now. DESC operates the Crisis Solution Center. There's too many acronyms in my brain. The Crisis Solution Center right now, and Lauren can share more about that, but really does respond to these immediate and acute behavioral health needs that folks have by giving them a bed to stay in while they connect to folks really being able to address their behavioral health crisis. And then the last piece that I know is also applicable to many of our housing providers right now is our designated crisis responders. King County employs designated crisis responders to assess folks for involuntary treatment. These are folks that our permanent supportive housing providers and others are reaching out to on a regular basis, looking for a community referral and understanding whether an individual that is in your housing building needs involuntary care. Designated crisis responders, I want to be clear, is not a first stop for treatment for behavioral health. This is folks that have been failed through our existing behavioral health system, who need a level of care that means that they are a harm and a risk to harm of themselves and others, and that taking away their civil rights and being able to force treatment is the best and only option available for us. For those folks, our designated crisis responders are struggling to respond in a timely manner. And so we are planning to position them at these sites so that they can refer and evaluate folks on site, but that they are also distributed across the county and more geographically accessible to folks throughout the region. So that's where I'm going to stop at Crisis Care Centers Levy. It will be going through council here for the next couple of months. Council is expected to recommend, adopt, or not adopt by the middle of February, which is their timeline required to place it on the the April ballot. And so we will see here in the next few months how that shapes up. And after April, we will be looking at an implementation plan of how we would implement that. Jesse, anything else you'd want me to cover on this before I turn it over to Leon?
I don't know if either you or Leon should cover it, but just maybe higher level, like what do you see as the coordination between the Crisis Care Centers Levy and the Veteran Seniors Human Services Levy? How do you see each of these two fitting into the broader spectrum of community human services needs?
Yeah, I'll share that the concept for the Crisis Care Centers Levy in part came out of the conversations that we were having with HDC and others last year, where we were asked to look at increasing investments in affordable housing at the regional level. And what we saw when we looked at the county's main priority of investing in supportive housing and addressing homelessness was that without a stronger behavioral health system, we could not continue to expand affordable housing. We have reached a point, I believe, and would welcome very much other insights, but have had this conversation with folks at DESC and other folks, that the acuity of behavioral health needs a different level of service than we can continue to provide in our permanent supportive housing and affordable housing space. And so that's one of the points of intersection. I think that is very much mirrored and continued in our intersection with the Veteran Seniors and Human Services Levy overall, where we are trying to truly connect services and be able to be mindful about the entire continuum of services folks need. So there are folks for whom we can prevent homelessness. There are folks for whom they can connect with community and therefore be able to prevent a behavioral health crisis or be able to maintain their behavioral health. For other folks, they need that higher level of acute behavioral health treatment. And so building out and continuing all of these services is going to make sure that we have a stronger network of care for our entire community. That's where I will stop, but I'm happy to answer any questions. And then I'm sure that Leon has a lot more to share about the role of Veterans, Seniors, and Human Services Levy in our network of services.
Thanks, Kelly. Any questions from the broader group here before we move on to Leon's presentation? All right, in that case, Leon, you ready to take it away?
I am. Thank you. I apologize in advance. I'm going to stay off camera. I'm struggling with some bandwidth issues and want to do my best to try and manage that. Bear with me while I share my screen. I'm realizing I do not have the ability to share my screen. If you could help me out with that.
All right, you are already co-host. Let me see if making you co-host helps.
Got the button now. All right. Can folks see that?
Yep, looks good. And
All
before,
right, so as Kelly did, sorry, go ahead.
just before we get started, want to note that if you have any questions, please leave them in the chat as you go. Want to make this interactive, but take away, Leon.
Yeah, and so just set the framework here. My intent is to get through these slides relatively quick to allow us to have an interactive conversation at the end. So if there's any questions, myself and the team will do our best to be responsive to those. So as you heard from Kelly and Sunari, we are currently on the third iteration of the Veteran Seniors and Human Services Levy. This most recent iteration is when we transformed to the VSHSL versus the VSHS with the incorporation of seniors into the levy. This slide depicts, as you all can very well see, that the past 2 times this levy has gone up 60% rate. Currently, this is a 10-cent levy. You see the numbers that roughly translate to $385 million. The way that the levy is overall structured is with 5 result areas and 3 populations, and we'll get into that a little bit more on the next slide. But the very premise of this levy is like, what can only the VSHSL do? We try to focus on where there's gaps in the system. We try to not be unintentionally duplicative and really focus our efforts on ensuring that the gaps are covered and that we are being responsive to our community's needs. And so we
Shoot, looks like he was kicked off.
I wonder if somebody else can share his slides for him.
Looks like Leon's back.
Wonder if that might help with the bandwidth issue.
I'm sure I left off.
Leon, do you want me to share the slides?
Can you see the slides now?
Yeah, your last slide, I still.
Not sure where I left off, but we're gonna just go with it. So the way the levy is overall structured is 5 result areas, 3 populations, so seniors, veterans, and then broadly resilient communities, which currently shows up as vulnerable populations in our implementation plan, and captures the human services broadly that you see called out in the levy. So here you see our guiding principles. Beneath on that bottom, you see housing stability, financial stability, so on and so forth. For all of our result areas, our 5 result areas, what our strategies are nested within. Today, we're going to be spending a lot of time talking about housing stability. As we talk about housing stability, the important thing to note is that if you look at the little chart on the right, 25% of the total levy funding, it goes towards housing stability. Where we're currently at in our planning process is right there in the middle, fall, winter. We have published our assessment report of this levy, which is available on our website. And then we are currently in the process of drafting and transmitting our ballot measure through the executive's office to council.
Hey, Leon, can you send me your slides so I can at least keep them going at the same rate?
Yeah, I'm sorry, it keeps on kicking me out. Just sent them over to you.
Okay.
The So currently, we are in the midst of transmitting our ballot measure ordinance through the executive office to council, which would put this ballot, put the levy on up for renewal in summer of 2023. So as we talk about housing stability, I have up here some of the investments that have come out of our housing stability, which in large part are being stewarded through our housing division, which Sunari is the deputy of. Here's another version of that, just an easier, less wordy way to see it, and you can track the numerous units that have been created as a result of this levy's funding. One of the unique things about this levy funding, in that it's population focused, we have the unique ability to have set aside units. So as we are taking VSHSL dollars and investing into the various projects, one of the things that we very intently look for is to create set aside units, whether it be for veterans, senior veterans, our resilient communities, or seniors. So what does all this mean? So underneath our housing stability result area, here's all the different strategies that we have that fall within that result area. This translates to roughly over $115 million investment. It includes not only building affordable housing, but creating shelter bed capacity. As you see down there, we have promote home ownership, where we've awarded, we took some of that and we awarded over $500,000 for foreclosure prevention. And we awarded another $800,000 to projects that will create 37 new home ownership homes for vulnerable households. And I'm sorry, I'm just flying through this and I'm gonna stop sharing in the hopes of it not kicking me out again. If it lets me stop sharing, there we go. So the intent there was just to provide a high level overview of what the VSHSL has been from a housing stability standpoint, and give the foundation for continued conversation and dialogue in this group around what are the gaps in the system that we think a future levy could be responsive to. What are some of the areas in which where we've done a good job and things you're like, we need to sustain? And frankly, where did we have opportunities to do things better, so that we can take that feedback and look to make sure that we are a learning organization and continue to make improvements to the levy in order to be most responsive to our community's needs. So with that, I really want to open the floor up, allow for questions. If there's any questions around the renewal process or how you guys can partake, please don't hesitate to ask. And between Sunari and I, we will do our best to be responsive.
Yeah, thanks, Leanne. Guess just to get us started off, what levy sizing are you considering for the renewal?
Yeah, so I want to just preface this with no levy rate decisions have been made yet. We are in the preliminary planning phase of this. And so what we've been modeling at this point is a 10-cent levy, and then also modeling a 12-cent levy, and looking at different options between those. But from a staffing perspective, just for planning purposes, those are the two scenarios that I've been looking at. But no levy rate decisions have yet to be made.
Gotcha. In terms of overall dollar amounts or dollar amounts a year, what does that translate to? And would each of those rate levels allow for an expansion of levy programs beyond just inflationary adjustments?
Yeah. So staying at a 10-cent levy, I don't have the exact number in front of me right now, but it's north of $600 million. And so if you were to equate this levy at its current rate and amount of funds, what it would be at this moment in time, this levy would be an 8-cent levy right now at its current amount. And so we are proposing keeping it, or not, I shouldn't say we are proposing, we are modeling keeping it at a 10-cent levy and a 12-cent levy, which is a substantial amount of more funding, which gets at the latter part of your question. So in the modeling scenarios that we are looking at what does it look like to have inflation year over year for majority of our strategies, coupled with whatever programmatic increase that we want to put on there. So there's really two buckets that we're looking at across the board for the bulk of our strategies. Is inflation's one conversation, programmatic increases is another part of the conversation. And let me know if I didn't answer your question.
Yeah, to tease that apart a little bit more, how much in terms of programmatic increases are you contemplating, and what would be the main priorities for those?
I'm not able to say at a global level. I think, as we take strategy by strategy, looking at past investments, looking at community need, also examining where we got significant community feedback in a respective area. Those are all the things that we are considering and trying to inform these decisions, as well as what if it was something that was currently funded, at what level was it funded, and what additional programmatic needs are there in that respective area. When you talk about housing stability and capital investments and projects, it sounds like a lot of money, but I know you all will tell me it's not a lot of money, and I can very much appreciate that when you're talking about building new structures or acquiring buildings that cost millions of dollars in that respect. And so it's balancing not only that, but what it costs to operate and so on and so forth. So we are trying to very much take a structured look at what is the need versus in conjunction with the inflationary cost, and putting all of that information in front of the leaders within King County, which will contribute to our rate discussion.
Anyone else here?
I have a question.
Yeah, Nathan.
Leon, have you done any stakeholder or public engagement up to this point? And if so, are you in a place where you can share any of what you've heard?
Yeah, we have done over, I want to say over 40 community engagement meetings. We've done at least 2 in every council district. We've done some focus group meetings with providers within certain strategies. And the overwhelming feedback that I think we've heard both on the positive and opportunistic side is overall the levy is a positive thing. We should keep it. We should increase funding to it. Flexibility of funding is a huge positive that we heard amongst providers, especially as it pertains to our flexible financial assistance that we offer. The challenges we heard were the timeliness of strategies being procured, the reporting requirements that come along with taking levy funding are sometimes burdensome, especially for the smaller organizations. Yeah, so I mean, at a high level, those are I think some of the themes that most resonate with me as you ask that question. But if you have any specific questions, I can go deeper on anything.
Well, that was what I was looking for. I'm also curious, though, if you have much more public or stakeholder engagement and outreach coming up.
Yeah, so we did a whole bunch of engagement really to inform our assessment report, which was asking, like, you know, essentially 2 questions: what did we get right, what did we get wrong, and to help us put us on a path for the future. Coming forward in next year, we will do a lot more engagement, really more around just informing of what the levy has done to date and allowing for feedback on the levy. But it'll be less interactive, I think, just on our part, due to the fact that it'll be something that is on the ballot, and we're going to be towing a fine line of not like appearing as though we are advocating as King County employees for renewal of the levy in that respect. But yeah.
Got it. Great, thank you.
Absolutely. While we're embracing the awkward silence a little bit, one of the other questions that has come to me is when and if the levy is renewed, what does that look like for existing contracted partners? And just to say, our intent is not to create any gaps in the system. We will be competitively reprocuring the bulk of the work that is described in our future implementation plan. But in saying that, depending on how the timing works out, we will be assuming the levy is renewed, doing extensions of contracts to make sure that we are not creating gaps in the system where a resource is needed and is not being provided due to the functional thing of a reprocurement that we need to complete. What other questions do folks got?
I guess one question is, how do you see engagement? How do you see HDC members best engaging on the Veteran Seniors Human Services Levy renewal, both before that renewal legislation is transmitted to the council and then during the campaign itself?
Yeah, so before we transmit, if there's feedback, I would say you can feel free to reach out to myself, Jennifer Lehman, who's our levy renewal manager, and we can make sure we share that her contact information. Also, Sunari is a great point of contact, and she'll ensure that any information gets passed along to myself as well. And then Leon, not as a King County employee, will be involved with other members of the community. And so I would encourage anybody on this call that is interested in participating in the renewal activities, to put you back on the spot, Jesse, I would say, share your information with Jesse, and then Leon and Jesse and others, as not King, like in my non-official capacity, will be in touch about how we proactively work together to do renewal type activities.
To flesh out that campaign piece a bit more, how do you anticipate the logistics of the campaign running?
So I'm not able to speak to the logistics of the campaign running. Typically, campaigns are managed at the executive office level, and then we are a part of that in that capacity. So what that looks like, that is to be determined, and that is something that is decided at a higher level than I'm able to speak to. Was there any other questions?
Yeah, I got one, Leon. I'm just curious. You said this was a 6-year levy, correct? So I was just curious how that was landed on, if that's solidified. And then also, just throwing this out there, HDC also convenes an East Side Affordable Housing Coalition that's made up of a bunch of affordable housing providers, direct service providers, homeless providers on the East Side. And we have monthly meetings. So would want to open that space up to you if it would ever be helpful to, attend one of the meetings and talk about either of the levies that were discussed today. Just kind of throwing that out there.
Yeah, we are absolutely willing and able to show up to any space that we are invited to. I think the more knowledge and more information we can share on the levy and the potential renewal of the levy, the better. This is, I believe, and Sunari, maybe you can correct me if I'm wrong, but one of the few, I think, resources out there from a housing perspective at this level that's specific solely to the county in that respect. And so it is absolutely, I think, invaluable resource to the housing community in that respect. What was the first part of your question?
I was just curious if you could talk a little bit about the conversation around the 6-year levy.
Yeah, so historically this has been a 6-year levy, and although the decision hasn't been made yet, I do not foresee this levy shifting from a 6-year levy. And the Cliff Notes best way I can think to describe it is at a 6-year levy rate, we are allowed to still grow the levy and its revenues up to a certain threshold based off of the property tax that revenues that we receive. The higher in years we go in terms of levy, the more restrictive that becomes. And then sometimes we get asked the question, why 6-year levy? Why not do less years? To this levy process that we are in right now is roughly, I would say, a 1 to 2 year process for us. And then when we talk about implementing a large levy like this, it typically takes us around a year just to get everything contracted. So currently, I want to say we have over 150 contracted partners, over 300 contracted programs. And so just from an implementation standpoint, the timing to allow us to competitively procure and allow programs to be sustainable over a period of time with secure funding in that respect. The sweet spot in there has been the 6-year mark for us.
This is Robin. Could I ask if there aren't any other questions that are more general, could I ask a practitioner's question? Would that be acceptable or?
Sure.
I was wondering if you heard back over the various implementation years of the existing levy from sponsors who struggled a bit in mixed finance closings that had VSHSL money with your senior veteran requirement related to fair housing and this additional side letter that King County had to put in place that stated basically that if you cannot lease with a designated percentage of senior veterans, the housing owner has to prove that you housed that many senior veterans in other buildings in your portfolio. And I was just wondering if anyone who's benefited from a contribution to their project of this type of money has raised that as a bit of a complexity. You get through it, but it's and typically your senior veteran units do not include vouchers, and they need not be homeless necessarily. And it can be a conversation for another day. Maybe it's an implementation question, but I wondered if that was going to be a requirement of the next levy as well.
Great question. I'm going to do my best to answer part of it and then maybe punt over to Sonari to fill in maybe where I get something wrong or she has additional information. But when it comes to the levy, I think we will always strive with our funding to create set-aside units for the designated populations. I think one of our biggest opportunities and lessons learned in this levy is our integration with our providers and frankly internally as well to ensure that we are doing everything possible to help connect people to the units that are available. I did hear some feedback from some providers around having difficulty finding veterans or senior veterans to go into units. And then, I talked to veteran direct service providers and they'll say like, oh, well, we have tons of veterans that are looking for housing. And so with that, one of the things that I've done internally to my division is I'm in the beginning stages of creating a system integration team that will have the responsibility of assisting with the connecting of some of those dots and to understanding where we have barriers and working to help remove those barriers. But Sonari, did you have anything else?
Okay. That's fine. That I understand the answer. So it's likely that those set-asides and preferences will continue, and the county's going to do perhaps a bit more in terms of brokering those connections as if we have shortfalls of finding relevant households. Okay, that's good. All right, I just wanted to confirm. Thank you so much. I appreciate it.
Yeah, not a problem. And Sonari, I saw you come off mute.
Oh, I was just going to say, I thought that was a great answer. I think we were aware of the issue, as you said, and, you know, glad that Leon's team is going to be able to help make some of those connections. I mean, you know, I've had a couple of folks just ask, hey, for better or for worse, we have a relatively fractured entry point into affordable housing units in this county. So,
Sure.
you know, every single provider kind of operates their own website and their own waiting lists, and sometimes those are even at a building level. And so for somebody trying to find a unit, trying to figure out where to go can be really challenging. And it's just the nature of the system that we've built. And so I think what Leon's talking about with how do we help people navigate the systems and connect them together is what we can do in the government side, you know, short of doing what some of our colleagues perhaps in New York or Massachusetts or San Francisco have done, which is actually create a single entry point for tenants. Because we definitely hear that from the tenant side as well, as how do I find the building that I'm eligible for?
Right. Okay. Thanks again. Appreciate it.
Great question. Any other questions? Well, not hearing anything and seeing that we have, I think, just about 5 minutes left. Again, Sonari, myself are available. If there's another space you would like to invite us into to talk about VSHSL levy renewal. I got a question in the chat. Currently, we are planning on an August ballot measure for renewal. And that's where our planning is driven towards right now. Again, no levy rate decision has been made to date, but I expect that decision will be made in the January, February timeframe. And that's a decision that is with our elected leaders, one being the executive and two being the King County Council. Not hearing anything else, Jesse, I can turn it back over to you.
Yeah, maybe I just want to close with a little bit of a reminder of the timeline here. So assuming we're doing an August ballot measure, you know, what are the relevant times we should be thinking about in terms of when does that need to become an official ballot measure? When does the King County executive need to transmit a proposal to council, etc.?
Yeah, so from a ballot measure perspective, you can expect that the executive will transmit something to council in the January, February timeframe. I want to say the council will have until April, and I'm going off the top of my head, April to have it move out of council in order to be on the August ballot. And like the April is I think the no later than date.
Great, thanks. And we've got a request from Roberta to share the PowerPoint presentation.
Yep, absolutely.
All right, seeing nothing else, close this out. Leon, looks like I didn't see the PowerPoint come in from you, but if you send that to me, I can get it out to everyone who registered for the webinar tonight.
Cool. I'll repush it. Not a problem.
Great. Thanks, everyone.
Thank you.
Take care.